put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Good morning, viewers, and welcome back to Youth Wednesdays here on the Tobago Updates Morning Show. This morning, we're talking about drug prevention, and we're chatting with two representatives from the Division of Health. They are Miss Shermin Joy Charles and Miss Lynetta Moore Andrews. Good morning to you both.
Good morning.
Good morning. Thank you for having us this morning.
No problem at all. So tell us about your function in the Division of Health in the ADAP unit. Did I get it correct?
Yes, that's correct. So the Alcohol and Drug Abuse Prevention Program is a unit, as you said, within the Division of Health, Wellness and Social Protection. And the unit is solely responsible for drug prevention education, which means we go out there and educate persons about the negative effects of substance use. And also we try to encourage them, for those persons who are using, to stop using substances, and for those persons who haven't started, to resist those substance use. So as the behavioral services officers within the unit, our responsibility is really to plan programs and activities and do education sessions focused on substance misuse prevention.
You wanted to add anything else? Or?
Yeah, that's basically. Right, so the ADAP unit, basically, we do a lot of drug prevention education in schools as well as called in the community.
Okay. And you all are behavioral science officers.
Behavioral services officers.
Services officers.
Yes.
Okay, right. Okay, talk to us a little bit about that.
Okay, so one of the as I would have stated, one of the main responsibilities of the unit is education. So as behavioral services officers, we are focused on educating the public, specifically looking at, as I was stated, the effects of substance use, not just on the individual, but on the family, on the community. And we also look at developing life skills, because what we realize is a lot of persons who are using substances don't have the necessary life skills needed to resist the substance use. So we're looking at developing those life skills that they need to learn to say no and to also resist those substances that they may be using. So that's the main responsibilities of the unit and also of us as behavioral services officers.
And before we get into what you all intend to do coming up for Drug Awareness Week,
yes,
let's talk about some of the things that your department would have done in the past.
Okay, so basically we would have done several programs. One of this is the Health Center Initiative. So that is basically each month we target a specific health center. We go out there and do a different substance misuse presentation, as well as the schools. Well, we actually do the different levels, the preschool, primary school, as well as the secondary, right? But there are different programs targeted for each one. So for the preschool, we have the Trinity Smart program, right? A lot of characters is there, puppets and so forth. The secondary school, we have the Project Alert program as well, and going forward. So basically, and other program that we would have done would have been our annual Clean Air Fair, right, where we target the standard 5 students. It's more, take on basically a more like a sports day event. So it's really fun, and as well, person get to learn about the effects of substance misuse, right? So those are some.
And I think we also have our symposium. So the Clean Air Fair is to commemorate World No Tobacco Day in May the 31st. And our symposium is to commemorate International Day Against Drug Abuse and Illicit Trafficking. And that is on June 26th. So we always use those two activities to observe those 2 days every single year. So those are just a few of the major activities that the units would be involved in.
And in terms of the high school project, the primary school project, what has the response been like? Because I think I remember doing Project Alerts while I was in secondary school. I didn't know that it still existed, that you all kept it going. What has the response been like from the young persons? Are you seeing results? Do you believe that it is effective? What do you think you all can work on in terms of those programs?
So the Project Alert initiative is actually not ongoing. So that's one of the things that we had in the pipeline, but we would have had to stop that initiative because of the COVID. because of the restrictions that came with COVID-19. So we have not been able to restart that program. What we have been able to do is target those students who would be at the Learning and Enrichment Center. And from the feedback we are getting from those students, one, we realize that a lot of the information that they are receiving in regards to substance use is misleading. So persons are more viewing substance misuse as something that is not really negative, it's more positive. So that's something that we've had to work out. But can we say that it's effective? We can't say at that point in time, because a lot of these, outcomes are long-term outcomes. And unfortunately, it's something that we have to work up. We haven't been able to, track and do some kind of track and see what is happening with those students who we have dealt with. So that's something that the unit has to work on, for sure.
And also what we're trying to do, try to boost up our preschool initiative as well, right? So in the past, we'd have done a short training with some of the preschool teachers. So now we actually have the resources to equip them to go out there and, educate our boys and girls, because we know that the earlier we start is better, right?
And alcohol and drug abuse prevention. For some persons, they may be wondering, why are you all even going to the preschools to tell the children about alcohol and drug abuse prevention, primary schools, secondary schools? How important would you say it is? Would you say it's you all are doing it because it's easier to get the information in while they are younger? Do you think it's an issue plaguing secondary school students, primary school students? Why is it so important to get the information in from such an early age?
So we can say that it is an issue that is definitely at the secondary school level. And we have seen it, students started using as early as 10 years. And what we realize is that they don't have the necessary information. And preschool is where you sort of have that foundation, where they have to learn this information. And we're hoping that when we're able to target them, start at the preschool level. So we're not going to just start at the preschool level and then stop, and then you try again at secondary school. But what we need to do is start at the preschool level and continue on, so that they always be bombarded with the information and with the knowledge that is needed to make those positive life decisions. Because it's not just only about substance use sometimes, but it's just positive life decisions that they have to make. So that is why we see the importance of starting at the preschool level, because you want to make sure that that foundation is there for them going forward.
Okay. And before we get into the information about the program that you all have coming up, we just want to take a very short break, and viewers will be right back. And we have a lot more information from the ADAPT unit, from the Division of Health, Social Services, Wellness, and the Social Protection. Wonderful. Okay, so we're going to take a short break. Remember to share the live, share the live, share the live. And we are back. It's Youth Wednesdays here on the Tobago Updates Morning Show, and we're still chatting about drug abuse prevention. So drug awareness week rather is coming up soon. Let's chat a little bit about that. What is Drug Awareness Week? What are you all doing to commemorate it?
Okay, so basically Drug Awareness Week is a week-long of activities planned, and this idea came out of our past manager, Billy Sterling Lewis, right? So the intention basically was to provide a wider platform to disseminate information on substance misuse, right? So this week, Drug Awareness Week will be held at the Coliseum. This is our main activity. We also, okay, so I will start at first. Our main activity basically, right, at the Coliseum Mall at Crown Point. We'll be having several booths. Some of the booths are the mental health units. So they will be having assessment in mental health assessment, sorry, right? We'll be also doing our screening as well in substance misuse. So persons who might have a problem, yes, we'll do referrals. Also, there is the food card assistant in emergency will be there, along with the REACH program. So there are several things being offered, and knowing us that, yes, of course, there will be drug prevention, education, presentation, and so forth. So yes, promising to be quite well. We can't forget the tokens, the giveaways, the highlights.
Okay, so you've seen the information there. Let's talk a little bit about the dates, the time. We know that will be at the Coliseum.
Yes. right? So the timing basically from 11 to 4 p.m. So we're inviting everyone to come out. Those in the surrounding areas come out. Even if you're from Charlottesville, you can still take a drive down there, right? So we're inviting everyone to be a part.
Okay, and is this the only program you will be doing for Drug Awareness Week?
Well, it's one of the highlights. The others will be okay. So Monday we would have released an article in the Newsday, as well as upload a video on Channel 5 and also our division webpage. Yesterday we visited 2 primary schools, the Montgomery government as long as with the Bonaccord government, right? And though yesterday was really fun, I must say, the children enjoyed themselves. We taught them a new song, drug education. Well, I can't sing it on side this morning, and I feel like a great singer. But trust me, they really enjoyed themselves, and the message was delivered, right? They received the message, embrace it. So we know that definitely there will be a change, right? Just having that song that's going on in their minds, so a person will have and that reminder that drug abuse is something that they should stay away from. Don't abuse substances because there are negative consequences that follows.
And what do you hope to achieve from this caravan? What is the end goal?
What we hope to achieve is, so one of the reasons why we did a week is that most of this, as I would have mentioned before, our awareness days are one day. And we realized that it is not enough. One day is not enough to really give the public the necessary information they need about substance misuse and its effects. So what we hope is that the public will become more aware of the negative effects of substance use. And the reason why we would have put it around the carnival season, just before carnival, because carnival is one of those occasions where persons abuse and misuse a lot of substances. So what we want to do is really get the information out there so that persons can make a well-informed decision when it comes to their substance use.
And is there a specific target audience? I know that is this specifically for the adults because you all do primary school, preschool and secondary school. So is this for adults only, or can anyone come and be a part of the caravan?
Anyone can come and be a part of the caravan. It's open to the general public. So we're inviting persons. You can come with your children. You can come with your mom, your dad, your grandparents. We want everyone to get the necessary information. And we also have the health screening. So we have the nurses who will be coming and do health screenings because we do realize that a lot of persons who are using substances also have issues with their blood sugar and their blood pressure as well. So we're going to have those nurses on site to do the necessary testing that may be needed. So we're encouraging the general public to come out. We have something for everyone.
Okay. And we spoke about things that you all did in the past. Is there anything else that you all have upcoming? Because we're only in February, so I can imagine you all have plans for the rest of the year.
Yes, we do. So what we have next upcoming, we have a secondary schools debate. That is something that we have targeted 4 secondary schools this year. We're hoping to target the others next year. And the debate is going to be surrounding substance misuse. So that is supposed to start this month, right? This month. And then we're hoping to have the finals in March. So that is one of the things, the most recent things we have upcoming. We also have the commemoration of our international days. And then we are hoping to have a life skills camp where we target children between the ages of 5 and 12. So it's going to be a 2-week camp, and we're looking specifically at improving their necessary life skills, not just to resist substance use, but to also make those positive life choices going forward.
And aside from the programs that you all are hosting, if someone wants to get in contact with the ADAP units, how can they do that?
Okay, so yes, we can do walk-ins as well, but our numbers is 639-3395 extension 47075 or 47076, and that's our head office number. Right, so persons feel free to contact us, and we are located at number 5 Montessori Drive, Glenwood, Scarborough. And you could always refer persons as well.
Okay, wonderful. So if you could just see the flyer one more time so that we could share the information with the viewers. Okay, so Thursday, February 8th, 11 a.m. to 4 p.m. at the Coliseum in Crown Point, Tobago, the Drug Awareness Caravan put on by the Division of Health, Wellness and the Social Protection, the ADAP unit. So, everybody just make sure you come out, support. It seems to be very interesting, a lot of information, a lot of prizes.
Yes.
Can't forget the prizes. Can't forget the prizes at all. Okay, so we want to thank you all so much for coming on and chatting with us this morning. I think I will be there, and I will bring Dwayne with me.
Beautiful.
Please do.
And I know Natalia would want to come as well. So we'll all take a trip down there. Okay.
Yes, okay. So
Wonderful.
looking forward, and thank you for having us.
No problem at all. So we're going to take a short break. Remember to share the live, share the live, share the live.